It's great to be here. You know, it's hard to believe 61 years have gone by since J.V. Irons invited me over to organize a meeting on diseases of nature affecting the public health. I want to pay high respect to J.V. Irons and all those that followed J.V. He was a great man, and Texas was a great place to introduce a new concept in public health, the use of veterinarians and their protege or associates in dealing with the zoonoses, which was a foreign expression at that time. I remember some of the top officials in the public health service making jokes about me and my zoonoses. It's, as you well know, zoonotic diseases now are occupying many people in public health. And the group here is a peer group in setting the measurements for other parts of the nation and probably for countries outside the United States. In starting or reviewing the past and the present and the future of veterinary public health, I go back to the old saw that when Joe Mountain had me in at the end of the war in September 1945, he said, "Steele, what are you veterinarians going to do for the public health now that the war is over?" And that was more or less my challenge and marching orders. And we got to it as rapidly as we could. And our first mission was to do a survey of zoonotic diseases, what was most important as we could measure it in the press on a daily basis. And it turned out that rabies was the #1 problem. And this was a dividend, or should we say, a leftover from World War II of people having had pets and the pets being lost or abandoned as they moved from one area of the country to another. And the incidence of rabies in dogs and lesser so in cats, and then we found out we had a sizable problem in wild animals, was our first challenge. And what was that challenge? We had to find a vaccine that would provide immunity for some weeks, some months, and some years. And this was our first responsibility of solving that problem. This came out of the good fortune of the Rockefeller Foundation. They had set up a program to study rabies in the 1930s and were closing it down after the war, that they had no time to carry on with rabies with so many other tropical disease problems. And to our good fortune, they said that they could have their laboratories in Alabama, and this was the beginning of the trials of different vaccines for duration of immunity. And within 3 years, we knew what our problem was. And to carry that to the field, one of the first places we carried it to was Texas in 1948-49 under Elmer Young. The state health officer and I had talked about the possibility of having a veterinary public health program, and they were very cautious about new ideas that would put new responsibility. But Elmer Young, a senior veterinarian, a man that was 10 years my senior, had a reasonable war record, and he came out and worked very diligently in getting a word out that there is a good vaccine available to control rabies, and he spread that word from Beaumont to El Paso, and I could say from the Big Bend country to the far north of North Texas. And this was the beginning of veterinary public health. We used that knowledge and information to give us confidence that we could go out and tell every state this is working well. And it's working because we proved it in Texas by 1950. And this was possibly one of the items of that first meeting of the successful control of rabies. Now, we had other problems to look at, but we went on to see what other things were appearing at that time. And one of the things that was most fortunate from my point of view, a personal compliment, was I was asked by Charles Williams Sr., the senior assistant surgeon general, aide to the famous Dr. Perrin, if I would come along with a meeting to meet with Army people and others that were bringing back millions of men and women from all points of the world. And they were bringing pets with them. And what concern would we have about the health of their pets, and what measures should we take to prevent the entry of disease that was foreign to the United States? And he brought me to that meeting, and he introduced me as Dr. Steele, our chief veterinary officer. That was the first time that I ever heard those words mentioned in the Public Health Service, and I was proud to carry them for the next 25 years or more in spreading the word. Now, our success with rabies carried on to other areas, and we'll come back to those as we spread into the other states. The first responsibility I had beyond Texas was to think of introducing rabies control into other states in the South, especially Florida, Georgia, Alabama, all those states surrounding the newly found communicable disease center. And then we carried on into the north, Alex Isaac in New York State, Oscar Sussman in New Jersey, Ernest Witt in Pennsylvania, and so forth across the United States. And the great thing was we had no failures, and we had no vaccine rabies, such as occurred with some of the earlier vaccines. A parallel problem that appeared at that time that had not been a great concern but was known to exist was the problem of psittacosis that was associated with pet birds. And this came to our attention within a few years after I had established the veterinary public health program in CDC in Atlanta, Georgia. The program was, how are we going to manage the importation of citizen birds and cockatiels and parrots? And these were very important pets because frequently they belong to embassies of people coming from foreign countries that wanted to bring their employees and in some cases their pets. But the big problem we had was the raising of citizen birds, where they're going to be allowed to be raised in South America or Europe, and where we wouldn't have supervision. To solve that, we endorsed a program for the veterans, and the VA, Veterans Administration, encouraged the veterans to set up bird breeding colonies both for canaries, the yellow canaries that sing so well, and the citizen birds that had less musical talent, but were beautiful pets to have around. And there our problem was to control the type of pneumonia that appeared in the birds and could spread to other birds and occasionally to human beings, psittacosis. And Dr. J.V. Irons brought that to my attention early and how we were going to control it. But the big episode occurred when the disease spread to turkeys and domestic fowl, mainly ducks. It never got into the chicken population, and something that I have no explanation for. But with the cooperation of Dr. Irons and his staff again, we had some young EIS veterinarians. Don Mason came out here to Texas to work with how we could maintain a surveillance and see what control we could have about the pet bird industry. And then when the turkey episode occurred, that was much more dangerous. And in retrospect, I remember Dr. Irons told me that he possibly had 3 or 4 fatalities that they did not recognize because they had no way of treating the pneumonia except to use the standard antibiotics of that period. They hadn't gone into more advanced antibiotics. Well, fortunately, we brought that under control by good hygiene in the turkey processing plants and eliminated any more disease. But we still had the problem on the farm and the turkey raising area, and it continued for 10 years or more as a principal problem. And some years later, it just kind of faded away. And why it has faded away, this was a famous talk about the disease given by J.V. Irons, I believe in 1975, which would have been 25 years later, when J.V. Irons spoke before this very same association, the diseases of nature, on the topic, what happened to psittacosis / ornithosis, ornithosis being the name that was applied to the domestic poultry. This then went on, was solved largely with cooperation of the Dr. Carl Meyer, a famous researcher of the University of California, and CDC, and people like J.V. Irons again, Don Mason, John Austin and John Anderson, just so many different people that all had a part of it. These are the successes of the first decade that carried on for decades afterwards, and I dare say rabies is still a principal problem, no longer in dogs or cats because of good vaccines, but because of the wild animal problem. And the wild animal problem has an extra flourish to it with bats being the principal reservoir in nature today. Returning to CDC, we had another problem that was causing us concern, and this was trichinosis, with the small worms of flesh of mainly the swine industry. And the United States Department of Agriculture had been dealing with this problem since the late 1890s, and their first control measure was to inspect all the meat under microscope, and John R. Moeller, a famous veterinarian of the old Bureau of Animal Industry, set up microscopic examinations in the 1890s and into the new century, and came to the point that the finding of new disease was so rare that they dropped that measurement. But then subsequent to that, we still had what you call a low rate of trichinosis that would appear annually in the CDC accumulative report. And the problem was, how are we going to get rid of this last residue of trichina or trichinosis, and this became a important challenge to CDC, and the cooperation of people like Peter Shantz that led the charge with other veterinarians in bringing the trichina control to the attention of all states so they would be concerned with it. The big thing that appeared at that time was radiation of food, and this was work done at the University of Michigan and Wayne State University by a medical staff, and they brought this to my attention, and we were able to organize a meeting with the American Medical Association to further the use of radiation in eliminating trichina in pork meat. The meeting went well, but there was much opposition to the use of radiation on the pork per se. So we had to intensify our level of hygiene, and to do that, the Department of Agriculture then enforced laws that prevented the feeding of garbage or recycling of waste, and by the 1960s or into the 1970s, we could say that we had trichina under control. But something else appeared unknown, and that was new strains of trichina that survived in the Arctic. And in the Arctic, that is the areas of Alaska and northern Canada, across Siberia and some parts of northern Scandinavia, there was wild animals or wild rodents that would carry the trichina. And this is the sole problem that remains. Other parasitic problems, such as tapeworms, Taenia solium, and Taenia saginata, were big problems in the population migrating into the United States, and we had some severe outbreaks of, when I say severe, I'm talking about sizable outbreaks involving thousands of animals and much investment by ranchers here in Texas, as well as the neighboring states and to the Pacific coast. But again, by good surveillance and improved meat inspection, this problem was brought under control by the 1970s. So today we can look to say CDC and its veterinary public health, as well as the associates with the program, have all contributed with the elimination, with cooperation, with meat inspection of the U.S. Department of Agriculture, and we can say that north of the U.S.-Mexico line, that this disease is under control. Parallel to that, we also had some new problems of identifying tuberculosis, a rare disease in cattle, but there was small numbers that would appear across Texas and some parts of the United States, namely Florida and Georgia, occasionally in the north. And there we ran into something new that we hadn't realized before. And this was the spread of bovine tuberculosis from cattle to wild animals. And the wild animals were namely deer and elk and so forth. So when we look to the challenges of the future, we got to look to what the problems may be among our neighbors, and this is the big responsibility of helping our neighbors, mainly through the Pan American Health Organization and through the World Health Organization and through OIE, which has now changed its name to the World Animal Health. And some of you may have seen in the press the eradication of rinderpest from the earth. It's the first animal disease that has been eradicated, and we can be hopeful that other animal diseases, possibly rabies, but it's hard to believe that would be in the foreseeable future. On the other hand, disease like bovine tuberculosis or brucellosis could be candidates for eradication. And we should remember that good public health depends upon good animal health. If you don't have good animal health, it's hard to have good public health. And that works as a part of a formula that leads to good economic health. And I've been working with my colleagues in putting that to mathematics and budget. Public health plus animal health equals economic health. It's something that we can extend to the whole world that is based on good health in animals and man. And some of the big activities that could be measured in the Western Hemisphere is the elimination of both bovine tuberculosis and brucellosis in our goats and sheep and cattle. Both these diseases in the Western Hemisphere would add billions of dollars of new developments in Mexico to Chile to Argentina to throughout the Americas. And we could also say the same thing for Africa and for Asia, except I don't have the data to prove that, but the same principle of good public health leads to good animal health, and good animal health leads to good public health. And we started claiming that, or putting it into print, at the first WHO meeting in 1950 in Geneva. I had the opportunity to be on that committee for the next 20 years and be the chair in the last meeting, 1968. So I look back on those years in the international area as some of the most productive areas of getting the recognition of veterinary public health. And in the Western Hemisphere, we have had great success with the promotion by Primo Arambolo and his colleagues that preceded him, that going back to Ben Blood, a period of 30, 40 years, all these have led to improved rural health and improved economic health, as I stated earlier. In closing, I should emphasize the importance of new diseases that are appearing. And naturally, the biggest one that has attracted attention is influenza. Did the 1918 influenza start in animals? And the evidence that we have today, we would say yes, but we never found any carcasses left over from 1918, such as they did for human cases. But we have to have a constant surveillance of our bird life as well as other animals to determine if the influenza virus has maintained reservoirs in other species. And one that was brought to my attention just this past month was the appearance of, or the identification of influenza C, the letter C. You know, we have A and we have B, and then we have a combination of A and B, and then we have C. And it appears that C has an animal reservoir as well as D and E. So the C, D, and E, all, and possibly others beyond that, we will find modifications in our animal population. So it goes without further saying, you young people that are digging into new diseases as well as old diseases, when you spoke about the possible cholera in Texas here, or plague, those are old diseases, but naturally they should be watched carefully, and any time of suspicion, any time they should be investigated thoroughly and treated as new invaders. On the other hand, we do have problems of the spread of viral dermatitis, a disease that could act like foot and mouth disease, but is very limited to West Texas, New Mexico, and Colorado. And this is where important laboratory surveillance is very, very important. And we can be thankful that, again, the colleagues and the health officers of Texas have one of the best health laboratory services of the nation, backed up by CDC. Now, I'm available for consultation and sit down and visit with any of you, but I know many want to be on your way. But I hope to be with you next year and carry on. And next year, as some of you may know, will be the beginning of my 100th year. And I say, gosh, it's great to be a public health worker because you live longer than anybody else. So, thank you all. Bye-bye.